Hello and welcome to Patient Knowledge. I'm Dr. Kirmani and today's topic is Hepatitis B. So let's get started. In this video, I will give you an overview on Hepatitis B, tell you about some symptoms of Hepatitis B, how it spreads within the community, who is at the highest risk of acquiring the infection, what's the treatment, and how it can be prevented. Hepatitis B is a viral infection of the liver. It causes swelling or inflammation of the liver. It's highly contagious, more than AIDS virus, because it is smaller in size and it can survive outside the human body for more than 7 days. It's epidemic in some parts of the world. Most people recover completely. However, some may develop chronic infection and have long serious illness. It can be fatal if liver cancer develops, and it's quite serious for infants to acquire this infection. What is a carrier? A carrier is a person who has not been able to get rid of the virus from his or her body. And carriers are a risk to other people and have a responsibility to inform their health professionals and other people about their illness. This is a picture showing what happens to the liver in different types of infections. The infection can be acute or chronic, so this virus affects the liver. In acute infection, there is almost a complete recovery without causing any damage to the liver. Whereas if there is chronic infection, it can cause significant damage to the liver cells. Initially, there will be swelling or inflammation of the liver cells. This is followed by shrinking of the liver cells called liver cirrhosis, and in a very few cases, it can cause cancer of liver. We call it as hepatocellular carcinoma. Now, 9 out of 10 people get the virus out of their body and recover completely. Only 1 in 20 become carriers. What are the symptoms? Some people are asymptomatic and are carriers, whereas others, the symptoms depend upon the type of infection. If it's acute infection, it can cause flu-like illness when the virus enters the body. People may experience fatigue, nausea, loss of appetite, jaundice, which is yellowing of skin and eyes, and pain abdomen and dark-colored urine. Whereas in chronic infection, this can cause damage to liver cells by causing inflammation of the liver. We call it as hepatitis. And further damage is caused by causing shrinking of the liver cells. We call it as cirrhosis of liver. And in very few cases, it can cause cancer of liver. Only 10% of people develop chronic infection, and it takes about more than 20 years for a person to develop cancer of liver or very serious complications of this illness. Since it's a highly contagious infection, the knowledge of its spread is crucial. So let's see how one can acquire the infection within the community. We can get infection when we come in contact with the body fluids of an infected person, such as blood, saliva, semen and vaginal secretions, breast milk, tears, and perspiration. It's usually picked up by absorption of infected blood through cuts and sores in the skin, sexual intercourse, sharing infected items such as razor blades, toothbrushes, needles, and syringes. One can also get infection through ear piercing, tattooing, and sometimes people with IV drug use when they share their needles. Now, who are the most vulnerable people? Healthcare workers such as doctors, nurses, and dentists, and hospital cleaners as well are likely to get the infection. Babies who are born to carrier mothers can get the infection. Children in kindergartens and schools, because they are exposed to a variety of people, can acquire the infection from there. IV drug users because of sharing of the infected needles. Male homosexuals, heterosexuals, and bisexuals with multiple sex partners, prostitutes, prisoners and other institutionalized people, and people of certain ethnic groups are likely to get the infection. Now the question is there a cure to this condition? There is no easy cure, but the good news is it's preventable. So prevention is by good hygiene and vaccination. Unlike HIV or hepatitis C, there's a vaccine available for hepatitis B. It's given in 3 doses. It's a safe vaccine and provides 80 to 95% protection from the disease. Now, what's the treatment? Carriers need to follow good hygiene, which means they should not share personal items such as razors or toothbrushes. They need to use a condom for sex. Be careful not to get another's blood on their cuts or wounds, so secure their cuts and wounds with the band-aid, and should not share needles in case they are IV drug users. They have to eat normal healthy diet, cut down on alcohol intake. And people with liver damage can be looked after by giving them some medications such as interferon, which will protect the liver from further damage, and antiviral drugs will clear the viral load from the blood. Now remember, a blood test can tell whether you have immunity or you are a carrier. And talk to your doctor about the prevention of hepatitis B. Be responsible just in case you are positive. Inform your contacts and your health professionals. That's all for today. I hope this information about hepatitis B was useful in understanding how the virus spreads and how we can prevent it. Thank you for listening. If you want more such kind of videos, support my channel by liking, sharing and subscribing it. Leave it in the comment box below if you wish to hear something from me. Bye for now.